Welcome to this week edition of Health Connect TV. Today we're going to look at a skin condition that is very common. I have the pleasure of inviting a GP with special interest in skin diseases who will do justice to this topic. Today we have Dr. Sandra Baker to Health Corner. Doctor, you're welcome.
Thank you very much. Thanks for having me.
Doctor, I'm sure you agree with me that many people want to know about acne, and we've chosen this topic because of the questions that's been asked by people, and obviously when you're in the clinic, we see this very often. Please, it would be nice if you can tell us, anything you'd like to tell us about acne. What really is acne, and what are the things that cause this skin condition?
Thank you. Acne is a common skin condition. It is actually a chronic inflammatory condition. This condition does affect the pilosebaceous glands in the skin. Pilosebaceous means these are the parts of the skin that contain the hair follicles and the ducts that excrete the oil into the skin and it goes up onto the skin surface. These glands are normally present in the face, on the chest and on the back. It's also present on the neck of people, and that's where you have most of these acne lesions. It is a common inflammatory condition, and there's a complex network of interactions of things that happen within the skin that produce these acne lesions. The acne lesions are most common in the young people, meaning especially the teenagers, and it's more predominant in ages between 13 and 16 years. Approximately 1 in 10 teenagers have acne, and this can progress into adulthood, and people even up to the age of 20, 30 years can still have the acne lesions. Some younger people also have acne, but that's not as common. If there are people with acne pre-puberty, those that haven't started seeing their changes, it's best to investigate these people as there may be something more serious going on. The doctors can be able to handle these situations, so these patients should feel free to approach their doctors in these circumstances. Okay, now I'd like to have a look at a picture which will depict what the normal skin looks like, and that will just give us an idea of the difference between a normal skin and a skin with the acne lesions. As you can see, the normal skin has the hair follicles, it has the sebaceous glands, and you've got the hairs in the hair follicle. You've also got the sweat pores. On the other side, you'll see the skin with acne. Here you can see the sebaceous glands. There you can see that it has excreted lots of oil. The oil normally goes up to the surface of the skin to lubricate the skin and maintain the skin barrier. But we can see in this picture that the duct is blocked. Okay, and there also you can see the bacteria. When there's lots of oil within the hair follicle, the bacteria can proliferate, and there's a normal bacteria that is present normally in the skin. It's called Propionibacterium acnes. This is a normal bacteria which does not cause any harm in the body whatsoever. But when the patient has acne, the bacteria proliferates and invades the sebum, that's the oil within the duct, and this can cause an inflammatory reaction within the duct and around the surrounding skin. And this does cause some reaction that presents as acne. In this situation, you can have the papules, what we call the papules, which is the slight swelling in the skin, and we can have nodules and cysts, but it can be quite inflamed and red and angry. Also, now we can go to look at the different types of acne, because acne, it can be graded into different types according to the severity. We can have the comedonal acne. This is the very mild form, but we have the black heads and the white heads. These are just the appearances on the skin as a result of the reaction that's going on within. This can progress to a mild form of acne. Mild acne, you can have the comedones, as I've mentioned earlier, but you can also have some papules. Papules are the small swellings on the skin. Some people may refer to that as pimples. Pimples on the skin, different parts of the skin actually. From mild, it can progress onto a moderate severity form of acne. In the moderate severity, you have the mild form of acne, but also you can have the papules and the pustules. The pustules are an inflammatory reaction. It means that there's some inflammation going on within the skin, and it is more severe. At this point, we will definitely need to have some treatments, because this will prevent scarring, because the scarring risk is quite predominant when the moderate acne does start off. This can progress now to severe acne. So this is the later stage of the severity of acne. Here you can have some features of nodules. So nodules are bigger lesions on the skin, and it can also be cystic, can have some cysts there too. This can lead on to scarring. The scarring that I mentioned earlier, which we do try to prevent by treating these conditions earlier. Scarring, we try to reduce or try to treat the acne in order to avoid the scarring, because it is very difficult to treat, and this is one of the complications. We try to get the treatments on track before the scarring can occur, and that's the best way to handle this. We'll now have to try and look at some of these, just to have a view and see what these lesions actually look like. On this one, you can see that there are some small white heads and black heads. This is the comedonal acne. This is the very early stage, and this is normally how the acne lesions often start off with. Then you can have, like as you can see now, you've got the different pictures, because I just want to give you an overview of the different grades and how they look, and you can see the comedonal acne is in the mild form. Then you can have the papules, the small lesions in the second one, as you can see there, and then you can see the red blotches there. That's the inflammatory reaction going on. And the third one, which is quite severe, you've got numerous lesions there. You've got some cysts and you've got some nodules. So this is the severe form of acne. This is the severe form of the acne.
And what about this?
This is acne on the back. The back is quite difficult to treat, and you can see this is quite a severe form. There's quite a lot of lesions there. You've got the nose and you've got the cyst. This one, as it is now, will definitely need hospital treatment, because it needs to be tackled aggressively. We can now have a chat about the risk factors of acne, because there's quite a few things that can aggravate these lesions.
That would be good to know.
Yeah. Okay. Yeah, that would be good, because it's good for people to know about this. We've got the pomade. These are thick creams or ointments that are used for the hair. You know, lots of ladies use that, but it's quite thick and it can block the hair ducts. So it should be avoided, because by blocking the ducts of the hair, the pores, it can enhance or aggravate the acne progression. So we should try to avoid that, definitely. Squeezing and picking the lesions, this is something that many people tend to do, and it should definitely be avoided, because by squeezing and picking the lesions, you're triggering this inflammatory reaction, and by triggering this reaction, it can progress quickly to scarring, which, as I've mentioned earlier, we should definitely do all that we can to try and avoid this. Hormonal changes that occur in ladies, because in all ladies, but of different severity, so we should be aware at the time, normally around the time the lady has a period, either just before, in a few days within the period, you can have these changes, and this can aggravate the acne lesions.
Does that affect teenagers, the hormonal changes?
Yes, definitely, and that's when it's more prominent, so it's good for them to be aware of this too. Excessive sweating and heat, when the environment is humid, that can aggravate the acne, because the pores can be blocked because of this sweating. We've also got medications that can aggravate the acne lesions. Steroids, that is something that I really need to talk about, because we use a lot of steroids for different reasons. We have steroids, we have the ones that we apply on the skin, and the ones for eczema, yeah, that's a good example. And we've got the ones that we take orally, take it in the form of tablets. So these medications can worsen the acne. So it's good to actually have a word with your doctor to mention this if things are getting worse. And there are also ointments and other medications. I won't mention all of them because of time, but anti-epilepsy medication can worsen acne. So it'd be worthwhile having a chat with your doctor if you're taking any of these and it does worsen your acne. There's no evidence really to support diets, because some people have said that, or have reported that when they have sugar or food that is high in glucose, that it does worsen their acne.
What about milk?
Milk too, that's one of them, yeah, that it does work, but there's no evidence to really support that. So can't really use that as a guide, but I'll just advise everybody to have a very healthy diet, and that has helped, because people have reported that when they eat healthily, that their acne has improved, and that is quite good to hear. So I would encourage that for patients that have the acne lesions, because it may help them. Anabolic steroid use, that is something that is quite important to know, and this is an artificial form of steroid, and it's often used by bodybuilders, people that want to build their muscles, and it does help to aggravate the acne. So if it can be avoided, that would be really good. Makeup that is greasy should also be avoided. There's quite a few things that can aggravate the acne, so these are just a few things that I'm mentioning. Polycystic ovarian syndrome is a condition that women can suffer from, and if they do suffer from this, they can have acne. It can be quite severe sometimes, and they may also have problems with their periods. They may also have hair on the body or on the face. So if you do have any of these features, it's good to have a word with your doctor, and he can help you manage this a bit better.
Okay.
Okay, now there are a few things. Stress, also known to worsen acne. Poor hygiene is not related to acne. It's not a simple skin infection because it's quite complex. That's right, because it's not a simple infection because it's quite complex. It's not contagious, and it has a good response from medications when used properly. So I just wanted to mention that to you. I think if we can incorporate this will really help us a lot.
And what about sunbed?
Sunbed use is not helpful at all.
Right.
That's right. Yeah, but it's not. It's not.
Right. Okay, viewers. Now you've listened to the introductory part of acne, these things that cause acne, the risk factors, and some of the myths. Now, we'll don't go away. We'll be back in the second segment to talk about how we can prevent acne. Thank you.
Health Corner on Ben TV by Crystalife is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show by Crystalife.
Welcome to the second segment of Health Corner. Today we're talking about acne, a skin condition, and we are lucky to have a GP with special interest in skin diseases, Dr. Sandra Parker.
Thank you.
Talking to us about acne. Now, in this second segment, we're going to talk about what are the things to do. We've obviously had what acne is and the risk factors. Are there things we can do to prevent acne, or are there treatment options out there for people to access if they have acne?
Yeah, thank you. There's quite a few things that we can do. There's some general measures that I'd like to mention first of all. We can avoid excessive washing. Some people believe that when they wash their skin frequently that helps their acne, but that is false. It doesn't work that way, because when you wash your skin, you can aggravate the lesions. Okay, so it's best to use mild soap, and you can just wash your skin as long as most times people wash their skin about twice a day or so. And it's also good to use lukewarm water, because it has been found that when you use water at the extremities of temperature, that's when it's very hot or very cold, that can aggravate the skin lesions. So lukewarm is perfect to use if you've got the acne lesions. Antiseptic wash can be used, that can help settle things down. And also, as I mentioned earlier, try and avoid picking the lesions, because it will only aggravate things. But I know there's always a big temptation to try and pick the lesions, but please don't do that. Water-based ointments or fragrance-free creams can be used, and that would minimize the aggravation of the acne lesions. Going on, it would be good to use anti-comedonal creams if you're applying cream to your skin.
So what is anti-comedonal? Is it the creams that do what?
These are creams that you can use that don't block the dots of the skin. Because if you use creams that block the dots, then that will aggravate the acne, and we don't want that to happen.
So these are less oily creams?
Yes, less oily creams, and they don't have those active ingredients that cause the pores to get blocked.
Okay.
That's right. So we can use that, and also fragrance-free, that is also very useful. So apply that to the skin.
Fragrance-free means that doesn't contain perfumes.
Yeah, or these nice smelling chemicals.
Oh, okay.
Okay.
So yes.
So that's good. So in the treatment of acne, there's quite a lot of things that we can do to actually help with the active treatment of these lesions. The aim is to clear the lesions and to slow down the progression of these lesions. And it's also good for us to be able to achieve limitation in the scarring of these lesions, because scarring is a complication we try to avoid, because by reducing the scarring we'll also reduce the consequences, which could be the psychosocial effects of these acne lesions, which could be quite detrimental to the patients. So that would be one of the things that we will try to achieve by treating these lesions. Treatment options are determined by the type and the severity of the acne. Okay, that will determine what we're going to do to actually treat this. And options can include no treatment at all. You know, that may be surprising for some people, but it's one of the options, and it is a valid option, because if the acne is mild or comedonal and it's not affecting the patient can opt not to have any treatment at all, and that's fine. That's a fine option, because the acne can resolve by itself within 4 to 5 years without any treatment at all.
Right.
And the other option is topical treatments. There's quite a few of them. I'll mention it just briefly. We've got the retinoids.
Topical means creams, is it?
Yeah.
That's the ones you
Creams
apply on the skin.
that you can apply. It could be in form of creams, it could be gels
Right.
that you can apply on the skin directly on the lesions. You apply it over the lesions and the area around the lesions. Okay, so I've mentioned the retinoids, we've got the benzoyl peroxides, and we've also got the topical antibiotics, which is very useful when you've got the inflammatory acne. The other option is oral treatments. Oral treatments, we have the antibiotics, the oral antibiotics, which is quite useful, and the doctor can advise you on the best one for you. And we've also got the combined pill. There are instances when that's indicated and that's required.
Right. Well, that's for, sorry, doc, that's for the females, combined pills.
Yeah, combined pills for the
No
females.
one is going to take combined pills. Okay.
For the females, please.
Okay.
And in oral treatment, we also got the isoretinoin, which is used for severe acne, but that's commenced in the hospital. There are other treatments which are started off in the hospital, such as laser resurfacing and mechanical or chemical peels, but I'm not going to go into detail with those options in this particular setting. I'll go into a bit more detail if you permit
topical,
me.
yes, the
Okay,
topical ones.
so the benzoyl peroxide, so that's one of the topical treatments, and in this treatment it's quite good because it does help to reduce the inflammation, it does help to kill the bacteria in the skin, and it does help to also unplug the blocked doors, pores. The pores that are blocked, it helps to unblock them, so it has a triple mechanism of helping these acne lesions, which is quite effective. We've also got the retinoids. The retinoids, there are quite a few of them. The doctor can explain which one's useful for you, but he will advise you also that these creams can cause some sensitivity, can cause irritation. So he will advise you on the best way to actually use these creams. Retinoids can't be used when you're pregnant or if you're trying to get pregnant, but your doctor will advise you what's best for you. Topical antibiotics, that's very useful. There's a wide range of them, and your doctor, as I mentioned, can advise you on the best one for you. Combination treatments are also well used in the management of acne. Combinations of benzoyl peroxide and antibiotics, or retinoids and antibiotics. This is a very useful combination because, like, you know, with all antibiotics, all antibiotic use, there's that risk. There's that risk of resistance, antibiotic resistance, and there's quite a lot of that going on now. So with the combination, as I've just mentioned, that helps to reduce resistance, which is very good, and that's what we would like to see, so that we can continue using these treatments and it will continue to be effective. Benzoyl peroxide and retinoids is also a very good combination. We now go on to the oral antibiotics. As I've mentioned earlier, your doctor will advise you on the best ones to use and how long you're going to use it, and other information will go accordingly. Isoretinoin is used in the hospital. It's commenced by a specialist dermatologist or a specialist doctor that has been trained to start this treatment and to monitor it very closely.
Right, isoretinoid. Is it a tablet or an
It's
injection?
a tablet. No, it's a tablet. It's a tablet. But there are quite a few complications and side effects from the tablet. That's why it will need close monitoring, and that's why the specialist doctors are trained to carry this out, and they will monitor it closely. But it is a very effective treatment. We've got the combined oral contraceptive pills. In the UK, there are two contraception pills that are licensed in the management of acne. You know, with
Right,
females that have acne. It's quite a severe acne, but the treatment is quite useful. Other specialist treatments, you know, are available, but those are instigated in the hospital and they are monitored accordingly. The duration, acne treatment, as I've said, is quite effective when done the right way, but it is known that many patients stop treatment early. They will try the treatment for 1 or 2 weeks and then they will stop. But that's a wrong approach, because it can take up to 4 weeks before somebody starts noticing the benefits of this treatment, and the benefits will encourage the person to actually continue on the treatment. But if you know that it takes a little while, you'll be, you know, reassured that you're okay to continue on this treatment. So we do encourage patients to persevere. But of course, if you're having side effects, please meet your doctor and he will advise you accordingly. So 4 weeks before you start noticing any improvement, 6 weeks before the improvement, you know, is really quite beneficial. The maximum response can be achieved within 3 to 4 months. If you're on antibiotics, we normally give them about 3 months use. If it's not working within 3 months, we can swap. So you can meet your doctor to change it to another antibiotics, or he can give you some other form of treatment. Even with antibiotics, of course, you'll still be on other creams alongside antibiotics to reduce the antibiotic resistance, as I mentioned earlier. Maintenance treatment for acne is also important, because with acne, even though it's a chronic condition, it does continue for quite a long time. Even when the lesions have resolved, it can flare up, it can recur. So it's good to be aware of that. And if that does happen, it's good for you to be on maintenance treatment. Your doctor will definitely have a word with you about that. And maintenance treatment does involve the benzyl peroxide or the retinoid.
So how long can somebody have maintenance treatment for?
Maintenance treatment can be on that for about 4 to 5 years.
Right.
Yeah, 4 to 5 years, and that's just a reduced version of the active treatment.
It's good for people to know.
Yeah.
Okay.
That's what it's a reduced strength and reduced frequency of the applications.
Right. So it's a prolonged use.
Yes, that's right, for that period of time.
Okay, so now I'm sure our viewers will be asking, are there complications of acne? Because we've talked quite a lot about this lesion.
Yes, sure. There's quite a few. I've mentioned some of them already in my earlier talks. The scarring is a complication because that's a sequel of the severe form of acne, and scarring is a big problem and it's difficult to manage. So that's why we try to avoid it in the first instance.
So when we talk about scarring, that is the skin that doesn't heal anymore, or what? It leaves a mark in the skin that doesn't go away. Is that
Okay, scarring. Okay, let me give an example. If you have a cut on your skin, it leaves a mark on the skin.
Yes, which is a scar tissue.
That's the scar tissue. So that's similar to the presentation, but there are different types of scarring. We've got the atrophic scarring, and you've got the hypertrophic scarring. Okay, and they're managed differently, but it's all hospital-based management.
Okay.
Yes, that's right.
Is there any other complications?
Yeah, you've got the infections, and that's why we use antibiotics and some stronger medications to try and treat that. And we've got the psychosocial effects, which can be detrimental to the patient, and that includes anxiety, depression, low self-esteem, and sometimes they may have some suicidal thoughts of suicide, thoughts that life is not worth living. So it is documented that there is that can be that progression. That's why we need to treat this aggressively, to manage it properly, to avoid these complications.
Okay. That is excellent, Doc.
Thank you.
Yes, I think we've benefited a lot from this week's edition of Health Corner. Today, you've actually told us a lot about acne. Well, viewers, you've listened to the doctor. This is Dr. Parker has actually done justice to this skin infection, which we see every day. We think that some people with spots on the face, you don't know what they're going through, but you don't know that actually some of them wake up in the morning, look at their face, and they're not happy, and they could be going through a lot of psychological problems. And we've listened to some of the things to do. Don't wash your face too much. Don't pick the spots. What it means, don't go squeezing the spots, because the more you do that, the more it flares up. And you remember there's a bacteria there, there's inflammation. So what we call inflammation, it gets in. And remember, Health Corner is here to partner with people, anyone who is happy to sponsor the show. So, we would like to hear from you. Don't go away. Always tune into Health Corner every Saturday. We are happy, to bring this program all the time to you. Thank you.